is with radiologists. No, even you should be aware of some types of paraclinic. What is paraclinic? Because the patient wants trust to you. You should be able to know, okay, it is تخطيط الدماغ, MRI, CT scan, X-ray. You should know what is the role of this paraclinic in diagnosis any neurophysiological dysfunction. Any neurophysiological dysfunction could be diagnosed by paraclinic. But what is paraclinic? You understood that what is clinical processing? What is clinical processing? Clinical processing means taking history and physical and neurological examination. What is paraclinic? What is paraclinical processing? Clinical processing, taking history, physical examination. What types of paraclinical?
Paraclinical audiology we take.
Like what?
Like
مثل الأزلمة مثل الأزلمة
شنو لازم؟
مسحها
neurodegeneration
سايلنت
لا يعني evaluate symptom.
What is the role of paraclinic? What types of paraclinic you know? I myself mentioned now. What types of paraclinic you have? You know. What is paraclinic? Yes. Like what? What paraclinics you know? Why? No, I didn't ask what is the goal of paraclinic. What types of paraclinic you know? Have you ever did paraclinic for yourself? Have you ever seen any paraclinic for your relatives? X-ray? Echo, very good, echocardiography.
MRI CT scan.
MRI,
BT
CT
scan. BT scan.
ECG, very good. Paraclinic like X-ray, MRI, CT scan, echocardiography, ECG. What else? MRI. See, this is lab test. Lab test is paraclinic. You take blood and you test some electrolytes, hormones, blood, nutrients. See, this is not paraclinic because IQ is checked in the clinic. Paraclinic is something that you send the patient out of. So, this is very important that you should know that you have also some clinical instruments in addition to taking history, physical and neurological examination. Is counting IQ paraclinical or clinical?
clinical
Clinical. You
Clinical.
take IQ in your office. It's not necessary to send the patient to some paraclinic office to account IQ. IQ means the patient here, you are here, you have some instruments you give to the patient and assess the IQ. So IQ assessment is a clinical assessment. So we can add something. Clinical processing includes taking history, physical and neurological examinations, and some instruments that assess neurological function. So, MRI, CT scan, and EEG or electroencephalography are some paraclinical procedures that you can use in assessment of the patient. What time you use paraclinic? This is very important. You saw that we have different etiologies which can involve nervous system. It means that you have problem in prefrontal. For example, the patient has some behavioral disorders. It could be due to some vascular disorders in prefrontal. It could be due to infectious disease, encephalitis. It could be due to some tumoral disorders. And it could be due to some neurodegenerative disorders. It could be due to some trauma on the head. It could be due to some chemical toxins. It could be due to some hormonal changes like hypothyroidism. And it could be some nutritional deficiencies like vitamin B12 deficiency. See, you saw that. Different etiologies, different treatments could have role in some symptoms. Behavioral abnormality because of some problems in social cognition and executive function. Which part of nervous system is involved? Prefrontal. But this prefrontal lobe could be involved because of different etiologies. If you could not differentiate between different differential diagnoses, you should go through the paraclinic. For example, with MRI, you can differentiate between is it because of tumor, because of neurodegeneration, because of vascular disorder, because of, and also lab tests. You can check thyroid hormone. You can check vitamin B12 level of serum. So you saw that if you have some signs and symptoms, a different differential diagnosis, and for appropriate treatment, you need exact diagnosis, you will go through paraclinic. This is the role of paraclinic. But sometimes diagnosis of some disorders are mostly clinical. In this situation, it's not necessary to go through paraclinical diagnosis. Most of the time for ADHD patients, for autism, these are what we call it clinical diagnosis. It means that for diagnosis of autism, ADHD, if you can correctly, has a history, has good physical examination, good neurological examination, it's not necessary to go through paraclinic. Most of the time for diagnosis of depression, for diagnosis of anxiety, it's not necessary all the time you have MRI, you have EEG, you have CT scan. What time you go through paraclinic, you cannot differentiate between different etiologies. This is something. And sometimes this paraclinic could be for follow-up and monitoring. For example, you have hypothyroidism and you are giving some pills like levothyroxine for treatment of hypothyroidism. You have vitamin B12 deficiency and you are receiving some vitamin B12 supplements. For follow-up, is this situation corrected? Hypothyroidism is corrected? Low vitamin B12 deficiency is corrected? You can, for follow-up, for monitoring the response of treatment, also you can go through paraclinic. But we have two types of paraclinic. One type of paraclinic check the neurophysiological function of nervous system. See, please pay attention to the words. This course was about neurophysiology. We have some procedures check the neurophysiological function of nervous system, like EEG, electroencephalography. Electroencephalography check the electrophysiological or neurophysiological function of the neurons of the brain. We have a specific protocol of MRI, functional MRI. MRI mostly is for a structure, show the structure of the brain. Any structural changes are detected by MRI, yes. But we have a protocol, we call it functional MRI. What is function? I told you the function of nervous system is what? No. This is the function. How this function is done, how we can check the normal functioning of nervous system?
Awareness, consciousness.
No, this is clinical. I told you, the main function of nervous system, appropriate response. This function is done through what?
Awareness.
No. No, these are the functions. Okay, awareness is done through
Consciousness.
electrochemical activity of neurons. All the functions, including awareness, consciousness, sensation, cognition, motor, and regulation, are done through electrochemical activities of neurons. We have this electrochemical activity of neuron can be checked by functional MRI. Functional MRI is a protocol of MRI. Do you know what is MRI?
Yes.
Yes.
Functional MRI tests the electrochemical activities of different networks. This is very, very interesting. And British accent interesting. It's very interesting that functional MRI can check, can assess electrochemical activities of different networks. For example, you have a patient with frontotemporal dementia. You will check MRI, functional MRI, and you see that the electrochemical activity of prefrontal lobe is decreased. So the patient will have problem in executive function. Check the function. Check the neurophysiological function. What is neurophysiological function? Electrochemical activity. The concentration of neurotransmitters is representative of electrochemical function. Do you believe in that? That the concentration of different neurotransmitters in different networks is representative of electrochemical activity of the brain in different. So, first, you should know that what is paraclinical processing? And what time you go through paraclinical processing? When you have differential diagnosis with different treatment, you will go through differential diagnosis, you will go through paraclinical assessment, including MRI, including CT scan, including functional MRI, including EEG. EEG and functional MRI are functional procedures. MRI and CT scan show the structure, we call it a structural procedures. What is disease? Any deviation from normal function or normal structure. So you can assess deviation from normal functioning and normal structure through functional procedures or structural procedures. That's just one thing remained very, very in summary. Can I clean it? Yes. Can I clean it?
Yes.
Okay. So, after diagnosis, etiologic diagnosis is clear. Okay, you reach to the pure diagnosis. First, for you planning the treatment, this is very important. Okay, you diagnose. Now what you should do for the patient? First, you should know that your goal is upgrading the quality of life. First, you should see what is the physical problem, what is the mental problem, and what are the problems in different performance. And you should have reached to this goal that you should be able to improve physical activity, mental health, and physical health. And based on your knowledge, your neurophysiological knowledge, you should consider some procedures to reach to this point. This is what you should learn during your course. Some golden recommendations. Again, this is for the, I think that for the 10th time I am repeating that. you should know different strategies. If you have just one strategy for any treatment, the probability of failure is too much. But if you consider 4 to 5 strategies, even if 4 of them are failed, 1 of them can be successful. You should increase your knowledge in this way. Okay, I diagnosed what is the problem. I have this art in addition to any physical problem. Also, I know the mental problems. I know the effect of the disease on the performance of the patient. Okay, I know. And I know what I should improve for the patient. But if you know just one strategy for upgrading, for promotion, the defects, the probability of failure is too much. But if you have different strategies for each problem, for example, you have a patient with attention defect. For treatment, you should have different strategies. For sensory enhancement strategies, you should have different strategies. For improvement of learning and memory, you should have different strategies. For empowering the executive function skills, you should have different strategies. This is what you should achieve in these courses. And also you should create some new procedures. But during this course, first, we have another word you should know. First is prognosis. Prognosis means your prediction of a patient's response to treatment. For example, in some cases, the patient is poor prognosis. It means that the family asks you, okay, this is my patient. What is your prediction about improvement? You say that unfortunately, because of the severity of symptoms and its chronicity, it's maybe the response of treatment is not too much. But we will try our best to call it good prognosis. But sometimes we say good prognosis, excellent prognosis. You say that because, for example, you don't have any structural change or neuronal loss. With our procedures, we hope to reach the best response. Well, excellent prognosis. Even we can make the patient even better than usual situation, ordinary situation. First, at the start of your treatment, you should have a prognosis. These are something that from now you should practice. For example, you are now here. What is prognosis? Okay, after 3 months, you should reach to this goal. This is a part of prognosis. You should be able to predict, for example, after 6 months, I should reach to this level of function, this level of performance. And you plan for these 3 months. It's a very structured approach for the patient. In your document, you should write it. And the patient and the family should be aware of that. And the patient the family enjoy that how structured your approach is. So, you should be able to predict after 6 months we should reach to this one. And during these 6 months, for example, each week you should have 3 sessions of occupational therapy. In each session, you should also monitor the treatment response. You should be completely solid on the patient. Okay, in this session, we should reach to this point. And if you haven't reached to this point, again you should come back here that what is the problem? I told you, for example, if after 10 sessions you achieve no improvement, maybe the patient has attention defect, maybe the patient is depressed, maybe the patient is anxious, maybe the diagnosis is completely wrong. Not after 3 months and see no improvement, there is a problem. No, during the treatment you should monitor the patient and monitor the treatment response. And if you are not reaching to the point of expected treatment response, you should come back and see what was the problem. What was the wrong? Maybe you have missed some important thing. I told you, sometimes even we come back and see the diagnosis was completely wrong. I have a lot of patients with diagnosis of autism. They reach to this one, the diagnosis was an anxiety disorder, not autism. The patient is not dementia, it's just a depression. The patient is not a depression, a stroke. The patient is not a stroke, it's tumor. See, you should see that. Where is the problem? That you should follow, you should monitor the patient in all sessions. Okay, this is a problem list. Again, check it. Now, what is the situation of this problem list? Any improvement happened or not? If based on your prediction, no, in the first session, in the second session, in the third session, we do not expect to see any improvement. Okay, no problem. But after 6 to 7 sessions, you still expected that now we reach to some improvement, but no improvement. Now you should come back. Maybe I have missed something that in my strategic plan I should consider. By this process, by this approach, you will be very successful in improving. This is neurophysiology. You learned neurophysiology, you learned neuroanatomy, and now you know what is the practical point of these lessons. And I will try my best to limit the questions from just this slide, because Dr. Bogheri also have some questions from his slides, and I'm sure that you will be very successful in the exam. So if you don't have, because most of you now is like very sleepy, and I think all of you will sleep till tomorrow. Tonight is Laylatul Ragat, yes? Yes. Means anything you wish to reach, if you pray, you will reach to. What is your wish that you pray God to give you? Really? No, so it's not necessary to ask God. You can ask me. Private. Political person, very dangerous person. Most of the politicians,
the project.
Anybody asks
The project.
him, and he, for example, if she or he doesn't have any answer, so okay, what is your wish?